toenail removal, removing a nail at home. Anyone who's ever had associate degree onyxis probably is aware of however painful, annoying, and chronic this condition will be. Whereas the easiest things to treat associate degree onyxis is to envision your GP or a specialist sort of a chiropodist, you'll be able to treat the minor onyxis reception. However, if you notice any complications, build a meeting with a doctor. Within the future, work on caring for your feet to stop or return. Removing a nail at home. 1. Clean the area thoroughly before beginning. With any form of procedure or treatment, infection could be a concern. If you've got an toenail, there is a smart likelihood that the skin around it's tight, irritated and inflamed already, creating it vulnerable. Clean your toe exploitation antibacterial drug soap and water to start out. It's additionally an honest plan to scrub your hands before you start. If you notice any signs of infection, like pus or sharp pain, don't treat the toenail yourself. Keep your toenail as clean as attainable and build an arrangement with the doctor. 2. Soak your toenail. Before you commit to take away an onyxis, soak it during a heat tub. This helps soften your skin and cut back swelling, permitting you to urge to the toenail easier. Place your foot in heat water with some Epsom salt and permit it to soak for many minutes before trying to get rid of the toenail. 3. Sanitize your tools. It's always a decent plan to sanitize associate degree tools your victimization before removing an onyxis. You'll be victimization tweezers or nail clippers to get rid of a toenail, thus sanitize this instrumentality before continuing. To clean or sanitize tweezers and nail clippers, wash them in heat water and medication soap. Rinse them mightily beneath running water, then pat them dry with a lint-free artifact. You can conjointly soak your tools and lotion for a minimum of 5 minutes to sanitize them. If a tool falls any place terribly dirty, sort of a restroom, throw it out. You are at an advantage employing a recent combine of tweezers or nail clippers than risking infection. 4. Clip the nail. Some ingrowing toenails will merely be clipped off. Use 8 tiny low-try of nail clippers to clip the ingrowing nail. Make certain to chop the nail into associate oval or curve. Merely trimming off the ingrowing portion might not be effective, because the nail might grow back within the same fashion. Cutting your nail into a curve will facilitate it grow out usually. After the nail has adult out, cut it straight across to stop the ingrowing nail from returning. 5. Place cotton or dental floss under the nail. Another option with ingrowing toenails is to separate them from the skin and allow them to grow out of the ingrowing form. To do this, roll a chunk of unpolluted, sterile cotton between your fingers to create a little roll or wick, or use a chunk of yarn. Use the non-flavored kind or it's going to burn. Slip the cotton or yarn below the ingrowing fringe of the nail to prop it up. The cotton or yarn can act as a barrier to stop the nail from growing inwards. Replace the cotton every night before bed. Your toenail ought to grow out of the ingrowing form with the assistance of the cotton or yarn. 6. Clean the nail again. Regardless of the strategy you used, clean your nail once more when removing the toenail. If you used cotton, clean round the cotton to avoid obtaining it wet. Continually apply antibiotic ointment when treating an onyxis. This may facilitate stop infection. You can buy an antibiotic ointment at a local drug store. 7. Watch for complications. After treating the nail yourself, be watchful. If you notice any complications, you must have the ingrowing nail assessed by a doctor. Look forward to the following: intense pain or sensitivity, pus or fluid drainage, abscess, fluid-filled sore or blister, major redness and swelling, fever or flu-like symptoms. 8. See a doctor for any problems. While the house remedies delineated on top of may fit well for non-serious unhealthy toenails, they will not essentially work for all unhealthy toenails or cases that have progressed on the far side of particular purpose. If your toenail does not appear to travel away, becomes worse, or shows signs of associate and nursing infection, create a rendezvous along with your doctor or a foot specialist as before long as you'll. Medical professionals have a spread of choices offered for treating badly unhealthy toes, as well as prescribing medicines and removing a part of the affected nail. A certified doctor are going to be able to realize a way that works given your condition.